So what's the importance of practice? What's important to you, whether you are a general practitioner? That's main. The general practitioner, this is the person, he or she going to see these patients. And the information out there is so confusing, so controversial. You know why? Because it's all come from the internet. It doesn't come from the classics, the perio classics, the endo classics, the prosto classics, which is no longer available to today's young dentists. So let me share with you why it's so important. In this molar here, this is the case where the dentist did the root canal through the crown. The patient failed, had pain, come to us at the endodontic at USC. A graduate student in endo retreated the case, sent it back to the prosthodontics who did the post. The patient developed more pathology. Dudley and Al created a surgical situation here, and we find this. The tooth was extracted. In this situation, only the buccal bone plate is gone. What's the problem? What's the lesson learned here? The lesson that the dentist who did this root canal did it through the crown. Worse dent treatment, that the endodontist who did the retreatment used the same access that the dentist used and led to the first lesion. And what else? The prosthodontist never questioned, although this crown was supposed to be removed, should have removed first. No, endo was done through the crown and then removed, and we did the post. And then we found the post and the distal was cracked. This tooth was cracked from day one. And the big mistake, even before the crown, the tooth was cracked. And the dentist did the first mistake. The endodontist did the second. The prosthodontist did the third. This is kind of education information I'm going to give you tonight. This information has been gathered throughout the years, case by case, teaching by teaching, and so on and so forth. This is my case. In Pasadena, they send me this case. Marwan, please take care of this problem. Well, they just put the crowns on. The patient had perio already with a lesion. I said, I don't do that. I must remove the crown. I must remove the post. I must retreat first. No, Marwan, the patient really doesn't have money. Please, see what you could do. Well, this is the first principle I learned. Never back up. Never yield to your principles. If you believe in something, especially in dentistry, a philosophy, you stick with it. Well, I did the mistake. I did my first retrofill here on this case. The patient goes for about a year, come back with a fistula tract on the second molar. Imagine that, the second molar. I put a fistula tract, it goes all the way back and makes a turn, come right back to my retrofill. Bad news. I was happy to see the fistula tract here, but did not expect it to do this. Make a long story short, I went back. We did the second retro. We pushed it a little bit further down, as you could see here. You could see some healing happening in this time, but not much. The patient come back in 8 months with the crown off and the tooth like this. We removed the molar crown, tested the tooth to be sure there's no problem, and then the dentist did this bridge. The mistake was there was a crack, a short post damaged the tooth, and it didn't go all the way down. You will see that the weakest link is the cervical zone, and we will talk about that. And the third case and the last case for this situation, this dentist had a patient had pain here, decided to extract the second molar, went in, started emergency endo, finished the endo, put a crown, and the patient developed pathology. Send it to me. I did distal buccal root amputation. Patient continue to have pain. You talk about a year, every year, the patient come back with a little problem, little bit resolution, more problem. And here it is after 3 years. The problem here, why not remove this restoration and see what's underneath? This tooth was cracked all along, and we were doing a perfect occlusion and a perfect treatment, perfect condensation, etc., etc.